It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, and welcome to the Sam Lesante Show, and welcome to Lesante Household. We're broadcasting here at my home for the Sam Lesante Show. Very important show today. I would highly suggest that if you're watching the show now, it'll be running a number of times. You get it on YouTube, you get it on our website, and also on LVH-Hazleton's website. Show that I think is being extremely important. There's a lot of questions we want to ask. Joining us today is the president of LVH-Hazleton and Dr. Lenko from Hazleton, LVH and Hazleton. Coronavirus has hit us pretty hard, and unfortunately Hazleton has been hit even harder. But hopefully there's some light at the end of the tunnel. First of all, I want to welcome you, John, and I want to welcome Dr. Lenko on the Sam Lesante Show.
Thank you. We're glad to be here. Very much.
Well, first of all, let me say this, okay? I know you a long time, and I know a lot of people, the doctors. I can't congratulate your entire force more than what you've been doing and how you're staying ahead of it, and the leader, I think, in the state of Pennsylvania with this coronavirus. Every one of you have been on top of it with your task force, we will talk about. But I want to congratulate you, John, and everyone there for doing an outstanding job, especially everyone. I mean, I don't want to let anyone out. So our congratulations go out to you. Now, John, let me ask you this. You could tell us a little bit about how the COVID-19 virus has been affecting Luzerne County, but most especially the greater Hazleton community.
When we opened our first testing site in Hazleton, we had a great response of the number of people who wanted to be tested. And of course, there are certain criteria that you needed in order to be tested. I'm sure Dr. Lenko's going to talk a little bit about that later. But what we were seeing, Dr. Jodi Lenko and Dr. Mike Evans, he brought to me some information that was showing us that the number of positives that we were seeing in the Hazleton area were alarming. The numbers were extremely high, and we were seeing those numbers almost double each and every day. And it was extremely concerning because, our area is very condensed, the city, and we were really concerned about the number of positives that we were seeing in the Hazleton area. On a county basis, we just got the new numbers this afternoon. We are looking at, in Pennsylvania, the total positives in Pennsylvania as of noon today were 25,345. And in Luzerne County, the numbers are 1,523 in Luzerne County alone. So Luzerne County's been hit hard, and specifically Hazleton has been hit hard. And I think we took the right steps as soon as we saw those numbers. I think as a community, we immediately jumped on it and put together. And I know we're going to talk about the task force in just a bit, but we really addressed it from all angles in the Hazleton area.
We know you've been working with Senator Udechak and also Representative Toohill, been doing a fabulous job in getting some of the key statistics regarding the virus made public. What went into your decision to do so, and why did you feel it was important?
When Dr. Lenko and Dr. Evans were sharing the information about the number of positives we were seeing at our testing sites, and what we were seeing in the community is we weren't doing the social distancing that I thought we needed to do. And we all thought it was extremely important that we shared the data with the community to make sure that they were well aware that the coronavirus is not something that occurs in New York City or in Wilkes-Barre. It's happening right in our backyard. And honestly, the data that we shared, we thought was important to get that message across to our community. And honestly, I think it worked. I think releasing the positive test information in our city, in the greater Hazleton area, was absolutely necessary and needed to open up those lines of communication and get some actions in place that we needed to do in our community.
In communicating with UDCHEC and Tool Hill and other officials, okay, how is that helping the cause with the hospital in terms of you need resources or whatever the hospital may need?
Well, so let me talk a little bit about that task force, if you don't mind.
Go ahead, sure.
And so again, early on when we saw these the number of tests that were positive coming back for our community, we put together a task force that consisted of Senator UDCHEC, that consisted of State Representative Tool Hill, Mullery as well as the local mayors, Mary Malone from the chamber, the United Way. We had others from the hospital on board. And what we did, and we would meet and we still are, every day at 2:00 we would have a call. And we would discuss where we are in Hazleton. And more importantly, it's not about the numbers, it's about the actions related to the numbers. So, okay, great, we're seeing an increase in numbers in Hazleton. What are we doing about it? And that's what this group worked on. We talked about what are the things that we need to do to improve our social distancing. What's the education and the communication with the Latino population? What are those gaps, and how are we going to work with them to make sure that we're communicating appropriately? Working with the industries to make sure that we're identifying opportunities at the local plants about social distancing, some of the things that we could do. And then on top of that, we also wanted to work on the buses and the vans that are going back and forth from New York City each and every day. And so it wasn't just one item. It was, and many more. And individually, housing is another one that we're talking about. So if somebody tests positive in Hazleton, we need to make sure that we can quarantine those individuals and not go back into a household of sometimes 8 to 10 members. What are our options to make sure that we can do the right things? Groceries, they need groceries. How do we get the groceries, the pharmaceuticals to them, their prescriptions? And so all of this task force has been focused on those key initiatives that we needed. In addition to that, what it did is it kept our Senator UDCHEC and Representative Tool Hill and Representative Mullery, it made them every day aware of where we are in Hazleton, and they have been a great asset to our community in helping us talk to the state and informing them where we are in Hazleton and where we are as a county. And I am so proud of what we accomplished with this task force, and there are other task forces as well, in a relatively short period of time. Very, very focused group. And again, our meetings last a half hour because most of that work that gets done in that task force occurs outside of that meeting. And so groups are working in addition to that. And so I think it's a key area that putting that force together, as well as putting another community, Hazleton community task force together by Representative Tool Hill has established that, and working with the local companies. So a lot of moving parts that I think are extremely well coordinated and have made a big difference.
Looking at cases today, I know every day is going to change, and we're taping on the 14th of April. So I'm sure, and I'm playing the show for a whole week, I'm sure things are changing. Are we seeing any type of progress in terms of peaking or leveling off or whatever?
I'll answer that, and then I'm going to throw it over to Dr. Lenko to make sure that she always keeps me honest. And so I think we don't know if we're peaking. The trends that we're seeing are exactly as we expected. We are seeing an incline in the number of admissions. We're seeing an increase in the number of patients in our ICU. And that's exactly how we planned it. That's exactly what we expected to occur. I will tell you that over the last couple of days, those numbers have held. So we haven't seen, we saw a pretty good increase over the past week, and then now it's kind of holding off. So we still have to study that. If the numbers go up tomorrow, okay, we're gonna talk about it. But right now, there's a little bit of consistency in the number of patients we're seeing on the inpatient side. Is there anything, did I hit that right?
I think that's accurate in that we're seeing the numbers stabilize for the last, I'd say, 48 hours, which is a very short window of time to make major decisions off of. So I think this is in the hospital only. So I think that's,
if we see that 5 or 6 days, I think we'll have a little more confidence, but in the numbers. But right now, that's where we are.
What if we see the numbers going down in the next maybe 4, 5, 6 days, and they're steady? What happens then?
So I think from what standpoint?
Well, as far I know, well, I know on the task force, my daughter happens to be on that task force as well, and she says it's extremely effective. But for example, the curfew in Hazleton, when do you think it's would be appropriate? You may or may not have the answer. Appropriate for Mayor Cassatt to say, okay, we can lift a curfew, but we still have to maintain the social distancing. We have to do the mask, etc. When do you think that's a safe time?
I think it goes into, unfortunately, the outpatient testing has a lot to do with how much community spread we know about. And because right now, this week, in the past 7 days, we've had to limit the number of tests that we can do on the community because we're in slight short supply of the testing materials, it's not giving us a very accurate picture of what's happening in the community for relatively healthy individuals that are not making their way into the hospital. So I'd be careful to make any judgments yet on that until, like the rest of the country, we have adequate testing materials to be able to say that in the community there's less risk of coronavirus.
And I'll add this, Sam. I think let's not get a false sense of security here. So as much as we're hopeful and where the numbers are, and even if they do flatten out for a week, I don't think we can, and I don't think we should, take our foot off that gas pedal of social distancing and until we're positive, because one of the concerns we have is by taking that foot off, are we going to create a second wave? And so we just want to make sure that we're all fair. You'll never be 100%, but we want to make sure that we have a level of confidence that this thing has leveled off. And I think that we would be, I just want to make sure that we don't over celebrate the reduction, that we still need to keep that social distancing and the initiatives that we've implemented in the greater Hazleton area until such time that Dr. Lenko tells me it's okay.
Tell the viewers what should they be practicing right now before we go to break.
The most important thing is if you are able to stay at home, stay at home. If you need something emergently like groceries or going to the pharmacy, that's reasonable. Make your trips short, only one person at a time going to those trips. Basically maintaining as much as you can in your home at all times. It's really difficult. I know my family is having a difficult time with this, with my kids not being able to see their friends. My daughter had her 6th birthday yesterday. She couldn't, had to have a Zoom party instead. But it's what we have to do for the community. So that's the most important thing. Understanding that some people have to go to work, and we do understand that. But if you can keep your contacts at home to your immediate family member, that will limit the spread of this disease.
And when you're out, wear a mask.
Folks, I'm talking to John Fletcher, who's the president of LVH Hazleton, and Dr. Lenko talking about certain things about the COVID-19. We come back, we'll talk a little bit more about what we should be doing and learn a little bit more about this terrible disease. We'll be back right after this. Well, welcome back to the Sam Lesante Show, folks, and welcome to the Lesante household. We're taping here at our home. Folks, I want to remind you that the show that you're watching and all the Sam Les shows, all of our shows, this particular show will be seen in Pottsville area on Comcast as well. That's Comcast 190 every night. We're on from 7 to 11 p.m. This show, you'll see, it's very important. So if you have any friends or family who wants to know about the COVID-19 and what's happening, how it's affecting Hazleton, I highly suggest go to 190. Also in the Wilkes-Barre, Mountaintop, Kingston area, we're on Service Electric Communications every Saturday and Sunday evening from 7 to 11 p.m. And so you'll be able to watch the show as well. Joining me today is John Fletcher, who is the Senior Vice President of LVHN and President of the LVH-Hazleton, and Dr. Jodi Lenko. Dr. Lenko, let me ask you this. What should the public do if they have any questions about upcoming appointments or if they need to make an appointment to see a provider?
So for many of our patients that are already established with our physicians group, which we call LVPG, Lehigh Valley, you can reach out to your doctor as you normally would. We are still all available. We are transitioning many of our visits to what we call virtual visits, meaning we're trying to eliminate as much foot traffic, both for the patient and as well for our providers and staff through the offices. So we're doing phone visits and video visits all across the network entirely, including in Hazleton. So if you don't have a provider, we're still accepting new patients. That's not an issue. We're happy to talk people through these difficult times. And they can always reach out. The best way to get is to go to My LVHN or go to the LVHN website, and that will link patients up to something called a patient portal, where they can access all of these visits basically through your phone or through your computer.
I understand there's now new testing criteria for the COVID-19. Can you share this new criteria with us?
This is Lehigh Valley's testing criteria. I just want to be clear on that. Every network and site has their different types of criteria for how they're testing patients. And we have always, since we opened our first testing site on March 13th in Hazleton, we've only ever tested patients that have had symptoms. We haven't done what we call screening tests to date. So we have been testing patients with symptoms up to this time. And then last week, about April 5th, the criteria throughout our network changed. This included both at all the sites in Pocono, Schuylkill, and Allentown, in addition to Hazleton. And the revision of this criteria was based on the fact that we've had some regional as well as national shortages of testing materials. And we needed to conserve so we wouldn't run out of the testing materials. So these testing criteria are now basically limiting the tests to patients that are at highest risk of developing complications from COVID-19 if they do get it. So we are testing all healthcare workers, or testing any first responders if they have symptoms. Again, this is only symptomatic patients, and then any other patients at high risk, which I can go to in a second. The other patient population that we're worried about is our patients that live in personal care homes and nursing facilities, because as we've seen in other parts of the nation, this has been a very delicate population that we want to make sure we take care of. So we are testing all those patients, and then pregnant women as well. In addition to that, there are some criteria to test patients that are high risk, and that includes people over the age of 65, any chronic lung problems such as asthma or COPD, heart disease, chronic kidney disease where you're on dialysis, things like that. There are a few other criteria that go into this. So all of those patients are still able to be tested for COVID-19 currently.
All right. Now, when you did mention the high-risk individuals, right? Patients age 65 and older, but this also is affecting younger people as well.
It is. It certainly is affecting younger people, and unfortunately, we have some of those younger patients even hospitalized. Unfortunately, the epidemiology is kind of driving our ability to test, and the majority of patients that are going to become sick from this are going to be one of these populations, whether they're older or have major health conditions that would make it a little bit more dangerous for them. But if you are young and don't fit into this criteria and you would otherwise recover, we think with a reasonable amount of certainty that you could recover on your own from COVID at home, those are the patients that we're asking you to still stay home. You can still reach out to us, and a lot of people have done so, asking if they need to be tested. And we ask that when you reach out to us, you do so via the phone and these video visits, so you can get that answer from the comfort of your home and from the safety of your home, so you don't have to go out into the public to be exposed.
Okay, so what are some of the basic symptoms that you're looking for?
The three basic symptoms that we've seen, and this has basically maintained true for the entire course of the disease, is cough, usually a high fever, and some amount of shortness of breath or breathing difficulties. Those are the three main symptoms, and that's what we use to determine whether or not somebody is what we call symptomatic. You have to have at least one, if not two, of those symptoms for us to consider high suspicion that you would have COVID.
All right, some people feel like they have COVID-19, feel ill with these symptoms and are not in the high-risk category. What should they do?
So by all means, reach out to your healthcare provider if you have one. If you don't have a healthcare provider, a primary care physician, a pediatrician, then please go to the My LVHN, the patient portal, and you can set up a video visit with any one of us. You don't need to have a previous primary care physician to do that, and you can reach out and find out what to do. They will tell you right then and there. A physician or a nurse practitioner or physician's assistant will tell you on that visit if your symptoms warrant you to be tested. It's confusing, and we get that, and especially since things change quickly with this disease, as they have over the past month. But that's where you can rely on us to help guide you through the way.
All right. Now, you're stressing here that they should not go to the emergency room unless your symptoms are severe or life-threatening. What should they do?
If you're symptomatic, please reach out to your healthcare provider. I've had multiple phone calls myself, being a primary care physician. I have either patients that were tested positive and they still have symptoms, and they call asking if they have a cough, they still have a fever. Reach out to your healthcare provider. The only people I want to go to the emergency room are people that are in we call respiratory distress, having very difficult time breathing, and their breathing is worsening.
The medicine that they're recommending, what are they? Have you used any of those? I can't think of the name offhand, but that they're giving some of the COVID patients who have coronavirus.
Sure. We're reserving the hydroxychloroquine, which is the malaria-like medication, and the other antibiotic called the zithromycin. We are using only those in the hospital. So you do not need those as an outpatient if you are recovering otherwise normally from COVID-19 as in your home. You do not need to be treated with those right now.
Doctor, some people have this coronavirus. They don't even know it. Is that correct?
Sure, that's what we've seen from other communities. Unfortunately, we don't have the testing supplies right now to find out which members of those community are potentially spreading it unwillingly to other members. So we hope that will be changing in the next week or so as we continue to, work on other projects to get this more community spread, community-wide testing.
John, you have a great staff, and you've been doing wonders. I'm trying to give as much information to the public because we're playing this all over the place. And once again, what could you say about your people?
Yes, Sam. So first off, let me say thank you for spreading the word for us. It's extremely important that we get this message out to the greater Hazleton area. And I would like to add that one thing that I've seen through this process is how we brought the community together, and truly how we're seeing our entire community working together towards a common goal of flattening this curve and making the greater Hazleton area a better place. I also want to talk about our frontline workers. They are the front line. They are doing incredible work each and every day without hesitation. They are putting their lives at risk. They know exactly what they're faced with, and they're doing it with a level of confidence and compassion that we as a community should be very, very proud of. I was up on the floors today. I was in the ICU. It's remarkable. I remember looking in one of the ICU rooms, and there was a nurse and a respiratory therapist, and they turned and looked at me and gave me the thumbs up. For the stress that they're under, it's amazing. And I just want to say thank you to each and every one of them. Our nurses, our transporters, our respiratory therapists, our rad techs, our physicians, you name it. This is an all-in game. We are all working together to take care of this community. And I also want to say thank you very, very much to the community who has supported us, who's donated food to our staff, who's done so many things, kind words that we received, the cards. It's just been an overwhelming amount of support that we received from the community that I know Dr. Lenko as well. We just want to say thank you, thank you, thank you. I always say this will not be won within the confines of the hospital. We're going to win this out in the community. And it's so important that if you want to do something for our frontline workers, social distance. Do everything you can so that you do not have to come into the hospital. That's the message we need that's the message we need to send, and that's the message I'm telling you our frontline workers would, if they all were standing here in front of you, they would say, please, please, please stay home. Do the distancing. Wear your mask. We don't want you to have to come to our hospital, and that's the best thing we could do for them.
Well, John, I want to thank you and Dr. Lenko for coming on the show. And remember, John, every day we're playing your COVID show that comes out of Lehigh Valley. In fact, I'm playing it more than once. I'm playing it 2 or 3 times throughout the 24-hour period so people can learn as much as they can about this. And, of course, Tammy's always keeping us informed of what's going on. So we're here for you, and we wish you the best. And most especially, John, we're offering a lot of prayers for this and the people who are working, and hopefully this will come to an end. Dr. Lenko, thank you. And John, it's always nice talking with you. Folks, you're watching the Sam Lesante Show, and remember 24/7 SSP TV, Comcast 190 in the Pottsville area, 7 to 11. Saturday and Sunday evening, 7 to 11 at Wilkes-Barre and Kingston Mountaintop. And I want to thank all of you, particularly in the Wilkes-Barre and the Mountaintop area, for the kind words about our shows. We'll see you next time.